Very happy to have Dr. Andre Williams here. Dr. Williams is an integrative oncologist and a hematologist. He's going to tell us all about his story, which you can also find at teshuvawellnessja.com. He's in Jamaica, and he's going to tell us about treating cancer from a more natural perspective, which is fascinating, especially since my interview, Dr. Williams, with Dr. Thomas Seyfried. I'd love to know if you heard of his work at Boston College, treating cancer as a metabolic disease. It was really fascinating to hear from him about all of that, especially since we're often regularly getting the message that it's genetic. You know, you have this genetic issue, or you just maybe you need more chemo and more radiation, and you just don't have enough of that in your life, or I don't know. It's just really, it's been fascinating to hear his perspective, not just as somebody who has been looking at both the cause of cancer, but is very critical of the treatments. And he's a pretty, he's not like a radical extremist kind of guy. He's this pretty seemed pretty middle of the road to me talking to him, which makes me wonder, why don't we hear about this more often? So I guess maybe my first question is just, could you tell us a little bit about how you arrived here? Were you always a doctor of this perspective? How did you
Yeah.
become Dr. Andre Williams?
Yeah, well, it's funny. I had no intention of ending up where I am. I started off as a regular run-of-the-mill medical doctor. I think what worked in my favor was I was fairly bright in medical school, and so when I emerged after graduation, I was accepted into a residency in our hematology program here in Jamaica. And in Jamaica, you have no choice but to be both a hematologist and an oncologist at the same time. And so at the time, there were probably, whilst I did my postgraduate residency training, there were probably 10 hematologists, oncologists total, treating a population of 3 million people. I emerged after residency as a what you'd call an attending physician, an attending hematologist oncologist, received a post at one of the leading hospitals here in Jamaica. And the plan was essentially to take advantage of the fact that there was a limited number of specialists in my area, make a name for myself, treat as many patients as possible. And my highest aspiration at that time was to raise the standard of cancer care here in my island of Jamaica. Somewhere along the way, I actually won an award from the American Society of Clinical Oncology for the work that I was doing in a third world country. I always do the air quotes for third world. Um, I got flown to Chicago for the annual conference. I met some of the top minds at the time in conventional oncology. It was a really big deal. I also had the privilege of meeting several other doctors from other third world countries around the world and continuing to exchange ideas both during that conference and beyond. However, at around that same time, I got exposed to the Gerson therapy, which you may be well aware of. It's a nutritional therapy with several decades of success in treating cancer and other chronic illnesses. And that was my first little peek into the world that I didn't know existed. Because, being a conventional oncologist, the general thing that we're taught is that there's no merit to alternative cancer treatments, that there's no benefit to them, there's no success documented, there's no medical literature to support it. And I'm sure you've had other guests on your podcast who will tell you some of the reasons why that is. But I got a peek behind the curtain when I did the Gerson, and that opened my eyes to the fact that there is a whole lot more to disease in general and cancer specifically. And the rest is history. I've been on a journey ever since.
Don't forget, $5 a month, and you get to ask the questions. You hate my questions? Let me shut up and ask your questions, okay? AlisonMorrow.locals.com and P.O. Box 3355, Denellen, Florida 34432. Send me some real mail. I get some really great mail. I got some seeds from a nice lady who lives about an hour and a half south of here. She knows I'm having a terrible time with the garden, so she sent me some seeds for vegetables that actually grow in Florida. So I love that stuff. You want to send me your loose pocket change, winning lottery tickets, I would love all that stuff. The producers get to open the cards on the way home. It really brings a smile to all of our faces. Really enjoy the notes of encouragement. P.O. Box 3355, Denellen, Florida 34432. And also, don't forget your Alison Wine promo. If you want to join the Alison Wine Club, you get 6 bottles every 3 months. These are high altitude, remote regions of the world. And we have opened it up to different countries. It used to be just Argentina, but now I think we've got Spain, Italy, France. These are naturally fermented, no filtration, no dyes, no chemical additives. They're just amazing wines, and they're a great way to support the show. AlisonWinePromo.com. Again, you'll never go empty-handed to a cocktail party. You can make up with grandma who lives upstairs because you're living in her basement because, I don't know, you just never done anything with your life. You're listening to Dr. Williams. You're like, you know what? I'm going to do something extreme. You know what? I'm going to do something with my life. I'm not going to live in grandma's basement anymore. Go to AlisonWinePromo.com and you can be an extremist without going to federal prison because these are all extreme altitude wines. AlisonWinePromo.com. They make great gifts. It seems like, just talking to you and talking to Dr. Seyfried, that really you could look at cancer not as a disease, but more even as a symptom of a disease. So it would be easy to stop and say cancer is the disease, but cancer, the more I learn about it, just seems like a symptom of something else that's wrong with your body. And so if it could maybe in other people form in another way. But for instance, I started getting headaches after my son was born, and there may be some issues with my thyroid, but I started looking at it kind of like those are just the symptoms. Like, it's not a thyroid problem. The thyroid is just the symptom. It's the canary in the coal mine of like something else that my whole body is dealing with. So is that kind of the way you look at it?
So I think the best framework that I've used over the years is actually the concept of the autonomic nervous system. And so if we view the body as a whole being rather than different segmented parts, then it means that there's one unified regulatory system that's controlling everything and seeking to achieve balance at all times. So the example I usually give is when you step out into a really hot, on a really hot day, you don't need to press a button or consciously think about sweating. It just happens. And there's so many other examples in the same way. You don't think about the rates that your heart is beating at unless you check your Fitbit or your Apple Watch. You don't think about how many breaths you've been taking in the past minute. So there's something that's always regulating our bodies. And for me, that's the autonomic nervous system. I think one of the dilemmas that we face now as a medical industry, a medical fraternity, and even as patients who have to visit doctors and other physicians, is this concern that, like you said, we're just focusing on the symptoms and not looking at the body as a whole. So you're correct. We have, for the purpose of academia, what we've done is divided the body into different systems, and that helps as medical students to be able to communicate, to exchange ideas. So we can say, hey, I'm looking at the cardiovascular system, and this is what I'm seeing. For the past 3 or 4 years, we've been hearing a lot about the immune system as if that was its own separate entity. But the truth is the body is one big system that's interrelated. And whilst it's easy to divide it for our own purposes, it doesn't see itself that way. So you're correct. Cancer is, I don't know if it's necessarily a symptom, but it is a dis-ease of the body, an imbalance or an inability of the body to regulate itself in a specific way. And you're quite correct as well in that the way that the body arrives at that state of imbalance can vary from person to person. And depending on the perspective that you look at it from, you'll see different pieces of evidence that help to create this overarching phenomenon that we see and call cancer.
The reason that I brought that up is because it seems like if you just attack the cancer cells, maybe it works or it doesn't work, but you might get something else later besides that. You see what I'm saying? Like, because you didn't really address the problem. Doctors don't seem to say that a lot to cancer patients. Like, look, you got something else going on here. Like, maybe we're going to do this to target the cancer cells. And I'd like to know what your opinion is of like radiation and chemo. But yeah, I mean, if you don't change whatever got you there, it could just seems like you get it again, or you get something else. Maybe you get something even worse. And so seems like it would behoove all of us, regardless of whatever, like, because I guess I kind of look at it like a chronic problem, just like another chronic disease issue.
Yeah.
If you don't get to the bottom of it, then you may get a few extra years,
Yeah.
or you're, maybe you get rid of that, but you'll get something else. Something else will come back.
Yeah.
Because you didn't get to the root cause. Is that true?
Yeah, so to use a very, very non-medical analogy, I use the concept of a potted plant quite often in my office, because I usually have a variety of potted plants scattered throughout my office. Funnily enough, I don't have one at hand right now. But I view cancer in the following way: is if you notice
Here.
that you walk, oh, there you, perfect. Oh, one of my favorites. Beautiful. So if you notice that one day you came home after vacation and something was wrong with the plant, it just didn't look quite right. And you said, hey, you know what I'm going to do? I'm going to snip off a part of the plant, the part that doesn't look like it's healthy. And that should do it. That we're all done. We're good. And you come back 2 weeks later and you notice there's another area of the plant that's really not doing too well. And you said, oh, you know what I'm going to do? I'm just going to snip that part off too. If you're not careful, you're going to keep snipping until there's no plant left. So my simple analogy is, why not just look at the roots, literally look at the soil, look at the environment that the plant is existing in, and see what is causing at the root of this plant, what's causing the leaves and branches to emerge in an unhealthy way. And I think my whole career has been, without me realizing, has been converging towards looking at more and more roots. So now when I see a patient, my first grid is to try and figure out, okay, what's at the root of this cancer? And once I've found that root, then it becomes a whole lot easier to recommend solutions. So I'll give an example. Just before I came on this broadcast, I met a young lady who I said to her, hey, I know you have cancer. That's why you're here on this video Zoom. But I don't want to hear about the cancer. I want to hear about you. And you would not believe it. Her first words were, without planning it, she said, I think that everything that's been happening to me has been rooted in my emotional turmoil over the past 2 years. And so I find that if you give the patient enough latitude to speak and to share and not focus in on the disease, as you shared earlier, Alison, most of the time you can kind of figure out why this happened to begin with.
Mm-hmm. Well, fascinating. I would like to know then how that kind of conversation can fit into what we see as conventional medicine, because it just seems like doctors are always late to their appointment and rush you out fast because they can't see enough patients. I mean, they're all just, trying to fly through the appointments. And, I'm lucky to have a great integrative medicine doctor, but even still, I've had to do quite a bit of my own researching through this process. So I guess my next question for you then is, how does a patient go in with that? Because you're not going to change necessarily the medical system, but how does the patient go in with the right perspective or attitude that to help themselves get to a point where they either can ask the right questions or they can help, maybe you have ideas of how to find a practitioner? Because it just seems like that the conversation you had with that patient, just most doctors, I don't know if they can't have, or they don't think they need to have, or what. But let me tell people first, they can go to your podcast. It's the Healthy Reasonings podcast. So if you like what Dr. Williams is saying, you want to hear more, he's got a podcast, and you can hear about all kinds of his other cases that he talked about, right? You talk about cases you've worked on and treatments you use and all that good stuff. So it's a Healthy Reasonings podcast, Spotify, Apple, and what else? Where else can people find it?
Amazon Music, Castbox. It's going to be everywhere as it slowly populates.
Okay. And then also, I just want to say thank you to everybody who has, in their free time, texted Alison to 989-898, because Birch Gold is sticking around for another month to sponsor the show. I made a joke, Dr. Williams, if you're just one of those people who has no friends after the last few years because what you've been posting on the internet and you're bored, but you're like, why do I even have a cell phone? I'm paying the bill, but I have no friends, no one to text, then just text Allison with 1L to 989-898. Start up a conversation with the folks at Birch Gold. They'll definitely keep your attention. We've got all kinds of interesting information about transferring your 401k or IRA into physical gold. For the first time in our history here in the United States, the interest we are paying on the national debt has surpassed every individual budget item except Social Security. And like I've said in previous shows, that means that we're spending more on interest right now than on national defense or even Medicare. I don't know if we're going to be spending less on national defense now that Julian Assange is free or more. I'm not really sure how that's going to affect things. We're going to have Steve Poikonen back on to talk about Assange tomorrow. But anyway, back to Birch Gold. If you are concerned about the US dollar, then consider talking to them about whether physical gold investment is right for you. Like I said, they'll give you your free, no obligation info kit on gold if you text Allison with 1L, ALISON to 989-898. Again, Allison, 989-898. And let me know what you think. Okay, so yeah, my next big question really is what I was saying before, which is number one, how does your model fit into the current medical model? I mean, can it? And then if you're a patient who you're looking around and maybe you don't have a lot of choices, how can you bring that perspective with you to the doctor's office? How can you love the one you're with, in other words, or is that impossible?
So I didn't tell you my whole story. The story continues after I found Gerson, and it's like I think they're gonna make a movie from this one day. So I'm hoping they'll use Denzel to play me, or
all right,
somebody like that. So, but the truth is, after doing Gerson, after winning the award, being flown to Chicago, being recognized as a top oncologist in my region, I did what everybody would expect me to do, which is I walked away from my hospital job. I quit and I started a private practice with maybe 5 patients and almost no money to my name. Because to answer your question, I just don't think that the model that's needed for healing of cancer exists within what we call the conventional system anymore. It never really did, because more and more of the guidelines have been based on strict algorithms. And the reason for the algorithms is essentially to ensure that everybody receives best practice, whatever that looks like. Mm-hmm. But then when best practice is dictated by only a small set of individuals without room for discussion, one wonders if it's really best practice anymore. So what happens now is, for example, I practice something called the Gonzalez protocol, which I'm sure we're going to talk about in a little bit. Mm-hmm. And what I end up doing is saying to my patients, hey, there's still room for us to monitor your cancer carefully using conventional imaging techniques and lab tests. And of course, being examined by your doctor is still important. You can actually access these things without necessarily taking chemotherapy or radiation. And so we kind of have a hybrid system that's unofficial now for most of my patients, where I provide as best as I can advice from a distance here in Jamaica. We do a lot of teleconferencing, and I say to them, hey, this is what I recommend that you do on your hospital visits. And the truth is, Alison, I have found, to their credit, that the majority of the oncologists still existing within the system, they're open-minded. You might not believe it, but they are. They're curious, and in many cases, they reach out to me, and we have good conversations around why I'm doing what I'm doing for this patient. But curiosity and open-mindedness doesn't change the fact that you're within a system that requires you to conform to a certain standard. And in my case, I could no longer conform to that, what I thought was an artificial standard. I didn't feel like I was able to practice personalized, individualized medicine for my patients. And I feel a lot more comfortable now with the outcomes I'm getting. And I have had some significantly miraculous outcomes with my patients now that I'm able to treat the whole patient, not just a disease.
Okay, give us, I know you could do a whole college semester or maybe even a year on these protocols, but could you give us the basics? What is it you're looking at, and what are the options that you're giving patients for treatment?
Yeah. So I'll stay right out of the gate that, as I mentioned earlier, there's no one size fits all for cancer. I don't think personally we'll ever have a universal cure for cancer. I think it's a wasted pursuit. I think that everybody arrives at cancer for different reasons, and it's important to be able to be individualized about assessments as well as management. At the moment, I'm a big fanboy of the Gonzalez protocol. Number one, Dr. Nicholas Gonzalez, a pioneer behind it, was himself quite decorated himself as a he was cutting edge as it related to immunology. And at the time, he was at Memorial Sloan Kettering. He was poised to become one of the greatest minds with bone marrow transplants, stem cell transplants, and he left all of that for the same reasons I did. He got exposed to the possibility that really what we needed to do to combat disease, and in specific cancer, is to help the autonomic nervous system to regulate itself. And so I'll give you a quick example of how the Gonzalez protocol works. The foundation of the protocol is something called metabolic typing. And you referred to Dr. Seyfried's work earlier, and he indeed found that cancer was a metabolic disease. His work has been so influential in the way I practice. So I wanted to say a shout out to him, and I'm so honored to be able to follow in his footsteps literally after his appearance on your podcast. But having done metabolic typing, what we do is we divide our patients into parasympathetic dominant and sympathetic dominant. Are you familiar with those concepts already, or am I going too deep?
I'm not familiar with them now.
All right, so let's give you a quick example. Have you ever wondered why Eskimos are some of the healthiest people documented on the planet, even though they eat only animal protein, lots of fat, and little to no vegetables all day long?
I haven't found myself wondering about it, but now that you bring it up, yes, that's interesting.
Yeah, so they're well documented to be in the blue zone, and despite the fact that they eat everything we would consider unhealthy. And the reason is that as we developed, our ancestors usually could be classified as either sympathetic dominant, meaning their body was chronically pushing towards more of a fight or flight response, or parasympathetic dominant, meaning their body's default was predominantly rest and digest. And then somewhere in the middle, you had people who were balanced. And so there was a bit of an environmental aspect to it as well, because parasympathetic dominant people tended to reside in very cold climates where the cold weather naturally would cause them to be acidified. And the options available to them as well, such as the Eskimos I mentioned, would be animal protein, which would again push them towards balance by acidifying their otherwise alkaline state. So coming from that kind of a background, it means, therefore, that if Alison, God forbid, should be diagnosed with a horrible disease, I should not naturally assume that Alison would benefit from either a completely vegan diet or a ketogenic diet and I hope I don't I hope I don't offend Dr. Siegfried having said that. But the truth is, whilst both types of dietary approaches have merit, we need to further individualize our recommendations to the patient in front of us. And I think at the moment, the Gonzalez protocol is the closest I've seen to that kind of individualized medicine, because you're treated and your dietary supplements, your detox, the kind of food that's given to you is entirely based on a metabolic typing process that is done at the beginning of your assessment.
How do you assess someone's metabolic type?
So the good news is that Dr. Gonzalez perfected it for us. So we just need to follow in his footsteps. And he had three different ways that he would do it. First of all, he would administer a questionnaire to the patient. And that questionnaire kind of gave an idea of, what do you tend to like more in terms of foods? It looks a little bit at their emotional responses to situations. It's a pretty long questionnaire, which is still available on the website, by the way. You should check out the Gonzalez protocol website. It's there. Secondly, we use certain parameters from the patient's labs to calculate their likely metabolic type. Yeah, so if you go to the Gonzalez protocol, click at the top there. There should be a link that says metabolic type test. There we go.
Okay. Oh, interesting.
Yeah, so you can fill out the questionnaire. That's one way. Then
I'm on the GAPS diet right now. Do you know GAPS?
Oh, I know the gaps. Absolutely.
Okay.
It's really good for gut health.
It's really helped me a lot.
I could just imagine. And just imagine putting on top of that further metabolic typing. So,
Mhm.
I'm not saying that any particular diet is wrong or right, but what I am saying is we need to avoid falling into the same trap that we did with chemotherapy and radiation, which is to just be prescriptive to say, okay, Alison, let's use somebody else. Jane has thyroid cancer, so we're going to ensure that Jane is on a vegan diet, regardless of
Mhm.
anything else that she says or brings to the table. And we're going to
Mhm.
give her chemotherapy because chemotherapy fixes everything, without taking into account anything else that Jane may say to us or explain to us, or have in her history.